Good evening. Welcome to all of you. I know over the last 48 hours, we have been going through a wonderful set of sessions as a part of the Indegene Digital Summit 2021. And we have covered a whole range of topics with brilliant speakers, incredible discussions and insights. So today we are coming to the finale of the summit with the keynote by the Honorable David J. Shulkin, MD. It's my pleasure and privilege to introduce David to all of you. Before that, what I would like to kind of highlight is the fact that till now we have been talking more about the business aspects of it, the technology aspects of it, the actual day-to-day issues which we are grappling with. Today, we thought the keynote session would be on a much larger issue around the overall healthcare kind of background. So with that being said, let me introduce David's brilliant background and let him highlight the key changes which are underway in the healthcare system. So the Honorable Dr. David J. Shulkin was the 9th Secretary of the US Department of Veteran Affairs in the Trump administration and the VA's Undersecretary for Health in the Obama administration. As such, Secretary Shulkin was the only member of the cabinet to have served both presidents and to have been confirmed by the Senate by a vote of 100-0. As Secretary, Dr. Shulkin represented the 21 million American veterans and was responsible for the nation's largest integrated healthcare system with over 1,200 sites and serving over 9 million veterans. Secretary Shulkin is a widely respected healthcare executive, having served as chief executive of leading hospitals and healthcare systems, including Beth Israel in New York and Morristown Medical Center in New Jersey. He currently advises leading healthcare systems and works with healthcare organizations that are leading the transformation of medicine around the world. As to his background, Secretary Shulkin is a board-certified internist. He received his medical degree from the Medical College of Pennsylvania, did his internship at Yale, and a residency and fellowship in general medicine at the University of Pittsburgh Presbyterian Medical Center. He continues to advocate on behalf of the country's veterans by serving on the board of numerous nonprofits that serve veterans. He is the host of the popular Policy Vets podcast and is the author of the recent book, It Shouldn't Be This Hard to Serve Your Country, Our Broken Government and the Plight of Veterans. With that said, I welcome Secretary Shulkin to talk about his view of the healthcare transformation as we are seeing on a day-to-day basis. Over to you.
Great. Well, thank you so much, Rajesh. And I appreciate the opportunity to be part of this amazing past 2 days. As great as it is, I hope that next year, Rajesh, we get to do this in person, because I think all of us are missing that. And being the keynote on a Friday afternoon is not necessarily the greatest, but hopefully it's a good way to round it out, as you suggested. So what I really want to talk about today is what's happening in the federal government and how should people who are attending the conference think about the changes that are coming, and understanding where federal policy and where federal dollars are flowing is a pretty good indication of what's going to happen in our healthcare industry. So if we could have the first slide up, please. Okay. So, great. Thank you very much. So, healthcare is going to continue to dominate the way that American politics responds, and whether healthcare tends to be either the top domestic issue, or as you're watching the news now, you're seeing the southern border and immigration becoming a top issue, and the economy is always going to be a big issue. Whether it's 1, 2, or 3, I think all of us believe it's going to continue to have a strong influence on what happens in the midterm elections and what happens in our federal elections in general. With the pandemic really top of mind of almost everybody now, 90% of Americans are worried about our healthcare system in the context of being able to address future pandemics. But people think about healthcare as it hits their pocketbook. 67% of all bankruptcies are due to healthcare bills. 88% of people believe that Medicare needs to get more aggressive on drug pricing. And we're going to talk about that specifically since I know it impacts a lot of people at today's meeting. But let's remember that 40% of all Americans wouldn't be able to put $1,000 together if they had an emergency. And with so many people who have pre-existing conditions and find themselves in emergency rooms, that's why this is such a tough issue. Next slide, please. So the way that you think about government policy and health policy is really in these three buckets. First is affordability. We just talked about that. Whether people can afford their medications, whether they can afford their health care, whether they have insurance or not, if they even understand what healthcare costs. The second major category is coverage, whether people have access to healthcare with the Affordable Care Act and various other plans. We're going to talk about that. And then third, how's healthcare paid for? How do people interact with the healthcare system? What's happening with digital health? And now, of course, with the pandemic. So we're going to cover this. Let's go on. What I'm really doing right now is just setting the stage while we talk about 10 major areas of health policy reform and where the budget's going to drive that health policy reform. And you can't set the stage for our healthcare market without talking about COVID-19 and the impact it's had on our healthcare system. 1918 was the last time we had a pandemic of this magnitude. Not too many of us were around then. There were actually two waves of the Spanish flu. The first wave was not as deadly as the second wave when our soldiers returned from World War I overseas. They brought a variant of the Spanish flu that turned out to be deadly. That may sound familiar to many of you with COVID-19. We're actually on our fourth wave here in the United States, but this last wave, the Delta wave, which is now 96% of the COVID that we're seeing in the United States, happens to be twice as contagious and more deadly as well, impacting even children in this wave, unlike the other waves. Let's go on to the next slide. And so just last week, you saw a new funding initiative come out of the White House, the Pandemic Preparedness Plan, with $65 billion. That used to be a lot of money when government would talk, but right now we're throwing around numbers in trillions, but $65 billion towards pandemic preparedness. And it has 12 categories of where that funding is planned for. We saw earlier this week, for example, number 3, diagnostic tests. We saw the government announce a number of new procurements done in record time to expand capacity of diagnostic testing and to pre-purchase diagnostic tests the way that they did in the vaccine. And so if you look through these 12 areas, it's an indication of where you're going to see money being flowing. Number 12 is pretty interesting. The idea, even though $800 million may not sound like a lot of money, this is the idea that the government missed in preparing for this pandemic in having a mission control, much like an Apollo mission, where it can view when new variants or new pandemics are coming. It can forecast them. It can predict the supply issues, the personnel issues, the therapeutic and the diagnostic issues. So we don't find ourselves always behind the way that we have with this pandemic in the United States. Next slide, please. And so when you take a look at the president's budget, the 2022 budget, those of you who aren't familiar, the 2022 budget actually starts in just a little bit more than a week. October 1st is when the fiscal year starts. Healthcare spending is due to increase by 23% from last year. So we've rarely seen increases in domestic spending this way. Sometimes we're used to seeing some defense increase expenses, particularly during times of conflict. But this is a pretty big expense, $133 billion increase. And just to sort of see where that goes, if you like to follow the dollars, HHS gets an additional $25 billion in this budget. 8.7 of that goes to CDC to rebuild for pandemic expenses. 10.7 into research for opioids. 621 million of that goes to my former agency, the VA, for opioids. The Indian Health Service gets a significant increase of 2.2 billion, FDA 3.6 billion, but when you add in their user fees, it goes up to 6.5 billion. So they're going to have significant new funding. VA got a 10% increase. So their budget, I think when I was at VA, we were just over 200 billion when I started. When I left, we were about 240, but now up to 269 billion. And I've pointed out some of the areas in VA that will see or benefit from that funding. There's 100 billion for broadband access and a new phase of emergency relief for providers of another 25 billion. Next slide, please. One of the areas that we're going to see expanded funding in is a new agency called ARPA, the Advanced Research Project Agency, borrowed from the term DARPA, which is the Defense Research Project Agency. But ARPA is focused on new investments in pharmaceutical and medical research, mostly focused towards specific areas like Alzheimer's, cancer, and diabetes. This was really not a surprise because President Biden was very passionate about expanding research opportunities. Okay, we're back, and I apologize for those technical difficulties. I was saying before that the president's proposal for a new agency, ARPA, should not be a surprise because as vice president, Joe Biden led the cancer moonshot work. I would meet with him every week in his office, and he was very passionate about additional investment in research, working with industry, working with academia to create advances in the cancer field. This is a picture of us. You might be able to see me with my fingertips to my mouth there as the vice president is directing the cancer moonshot. Next to me, at the very far end, just for those of you who follow this, with his hand over his mouth as well, is Jeff Zients. You may know Jeff Zients because he is the person leading the pandemic response for the president for the country and the scientific advisor. So the president's passionate about this. Next slide, please. And so the takeaways from the Biden 2022 budget is that there's a lot of increases, but in funding, but they're going to have to be supported by new revenue. And so the president plans in this budget for tax increases on corporations and high-income households. You may have seen today this did pass the House of Representatives, where they did vote to support these types of increases. It will now go to the Senate. The president's budget also calls for tax credits to sustain the Affordable Care Act as part of the American Rescue Plan. This would, if goes through, essentially create premium support so that any American who is at 150% or below the federal poverty level essentially would get premium-free insurance. That would cost another $163 billion. The budgets for Medicare and Medicaid, just a 1% increase, so no significant plans there. And there's really nothing in this budget that talks about the public option, nothing that talks about lowering or expanding the Medicare eligibility age, nothing about new benefits for Medicare, and nothing about lowering prescription drug prices. One interesting thing that I did want to note, because with just a 1% increase projected for Medicare and Medicaid and no real reform proposals, at the same time, the Biden administration reduced the budget for the Center for Medicare and Medicaid Innovation, which is the part of the organization that would focus on new models of care, and yet they cut that. So little bit of a mystery here. Next slide. And so right now I'm going to bring you through the 10 major key aspects of health policy reform and where these monies are going, so that you can begin to understand what may be happening, and hopefully that will help you in understanding how this impacts your business. So the first is payment reforms. The president clearly has signaled his support for the Affordable Care Act. Not a great surprise, considering that he served under President Obama when this was passed. But what people need to understand about the Affordable Care Act, because it does expand insurance to those that are uninsured, these are really high deductible plans. These are plans that have around $6,500 in a deduction, so that somebody who goes to an emergency room or gets hospitalized or needs a procedure, while they believe that they have insurance, come away with a very large deductible. And so therefore, this does not eliminate the issue of affordability in healthcare. Okay, you want to continue with audio? Okay, so we were talking about payment reform and the fact that affordable care plans are really high deductible plans. So there is going to need to be additional ways of paying for healthcare. And so you're going to see new ways and models for paying for healthcare. Some of them call them value-based models. One of the real lasting consequences, I believe, of the pandemic will be on payment reform. It was a very cruel pandemic in many ways, in that while the provider systems, I'm talking about hospital systems, were overwhelmed with patients with COVID, they had to cut back on their elective surgeries and their other types of patients that they take care of that were more profitable. So provider systems ended up losing lots of money, where insurance companies who didn't pay for those elective surgeries ended up making a great deal of money. So the lesson out of this was that you want to own the premium risk during a emergency like this. You'd rather be on the insurance side than the provider side. And this has stimulated many, many healthcare systems to look more deeply at getting into risk-based contracts and sharing risk with insurance companies. And that will make a fundamental change in our market for a long time. Let's go to this slide, which is let's go back one to Medicare Advantage. Medicare Advantage is where the providers or the payers can take the risk of the premium dollar from Medicare. And you can see how rapidly this is growing. There are numbers of organizations now setting up, becoming public companies who do nothing but take Medicare Advantage risk. And so you will continue to see a push to get out of Medicare fee-for-service and more into the Medicare risk or Medicare Advantage business. Let's go on. And this is important if you are involved in healthcare, understanding how providers and payers are thinking about future contracting. Medicare also is encouraging organizations to take risk through joining and entering into accountable care organizations. Now, accountable care organizations, when they started about 8 to 10 years ago, were what were called upside only. You could only get additional dollars. You couldn't go downside. You couldn't lose money. Medicare found that did not work for them. That did not save the government money. But when they've allowed both upside and downside, so organizations really are at risk, they found that they were effective. So they are continuing to encourage organizations to take risk through accountable care organization structures. You're also seeing specialty providers now entering into a form of risk taking in bundled payment programs. You see there are 187 new oncology entrants into the bundled program. For orthopedics, 465 systems taking risk for joint replacements. And you can see 484 in the middle there, hospitals participating in the bundled program, a form of payment risk. Let's go on to the next slide. Now, one of the things that can affect the pharmaceutical industry is when they begin to start looking at alternative payment systems. And I'll give you this one example. Hopefully it will show you what can be done. When I was secretary of the VA, I asked the question, how many veterans that we cared for have active hepatitis C? We were able to go into our electronic health record, and within less than a week, the answer came back to me: 167,500 veterans have hepatitis C. The next week, when I was testifying before Congress and a senator asked me a question, I slipped in that it was my goal to eliminate hepatitis C among all veterans in this country, knowing that the senators would applaud that because it was a very bold pro-veteran move. And after they finished applauding that statement, I said to them, now all I need is $1.5 billion from you to pay for that. They gave me $1.5 billion, and I set out to eliminate hepatitis C. We contacted every one of those 167,500 veterans, and we offered them treatment with the drugs that are very effective, 95% at reducing and eliminating hepatitis C. And today, there would be less than 10,000 veterans in this country who have hepatitis C. So we demonstrated that if you have the responsibility for caring for a population of patients, in this case veterans, that you can boldly go after an entire class of disease and you can begin to have an impact. And that's really called population health contracting. We've seen this begin to happen in some states in conditions, chronic conditions like hepatitis C, as well as diabetes and others. And this is an alternative payment strategy that I believe is going to become more popular in response to some of the forces that we're seeing with cost issues for drugs. So let's go on. The second major change that we've talked about already are the investments in public health infrastructure. And because I showed you the $65 billion just proposed by the White House, I'm not going to go into this further, but this will be a continued and sustained investment after the pandemic has long gone because of what we've gone through, the impact that it's had on the loss of 678,000 Americans and the impact on our economy. Next slide, please. The third issue is the rise in healthcare costs. Now, this is something that when the pandemic started, I started to talk about and write about. And since Medicare, especially Part A, the hospital trust fund, is funded almost solely by employer and employee taxes. When I saw the magnitude of job losses that we were having because of COVID-19, I did some calculations and said that our Medicare program would become insolvent in 2023. So that was back in 2020. 2023 is now almost around the corner because remember, fiscal years start in October, so we're really only a year away. And I thought my calculations were pretty good. In response to what I did, the Congressional Budget Office did their own calculations and said I was wrong. It was really 2024 that Medicare would go broke. So we're talking about the biggest program in the country going broke in 2024. And in this case, the government cannot just print money and spend. The hospital trust fund explicitly must be funded within the budget, as opposed to Medicare Part B, physician fees, where you could dip into the general funds and just print more money. So this is a major threat to everything that we know in this country as it relates to healthcare, insolvency, and we haven't solved the issue. Now, the trustees of the Medicare fund have recently, within the last 30 to 40 days, put out their own report and said, we do not agree with the Congressional Budget Office. We believe we are not going to go broke until 2026. So whether we're talking about 2023 like I predicted, 2024 like Congress predicted, or 2026, or maybe something in between like 2025, this is still a major problem. So we should be paying attention to it. The only way to fix this is to raise taxes, by the way. Secondly, price transparency. This is having a major impact on the industry. The rules and the regulations now say that hospitals must publish their prices. And while every hospital did it, and you still would have a hard time figuring out what your hospital is going to charge you because they've printed their master price indexes, which are really like printing the tax code. You can't interpret it. They are now going to be required starting next year to publish the exact reimbursement an insurance company pays them. Once they do that, it is going to be understandable how much these procedures and admissions and services cost. We've never seen that in healthcare. That's going to be a game changer. Balanced billing provisions going through Congress. It's going to be very hard for providers to continue to bill the way that they have outside of the insurance system. And then the one that I think probably relates most to people on this call, what's going to happen with prescription drug pricing? Let's go on. Next slide. Now I'm going to tell you, and you guys should pay attention to this, not that I always get my predictions right, but I think the next 2 weeks are going to make a big determination in whether we see a major change in prescription drug pricing. And the reason for that is I'm going to suggest that you should watch carefully what happens to the infrastructure bill. If the infrastructure bill gets funded, if it goes through Congress, remember the proposal by the administration is $3 trillion. I keep saying billion because it's hard to say trillion. That's so much money. $3 trillion. The progressives rejected the bipartisan call for 1 trillion, but even a trillion's a lot of money. So if the infrastructure bill goes through at a funding level of $1 trillion or more, Congress has to pay for it. Now, there's two ways that Congress can pay for it. One is they can print more money, but that would require that they vote to increase the debt ceiling. My prediction is that's going to be a very hard thing to do, that the Republicans will not go along with an increase in the debt ceiling. And that, by the way, is going to lead to a government shutdown. So do not be surprised if we have a government shutdown. With President Biden's ratings being as low as they are, the midterm elections around the corner, the Republicans would not mind having a shutdown demonstrating the dysfunction of the government. But even if they do increase the debt ceiling and this infrastructure bill does go through, Congress still has to pay for it. And the only thing on the table that I am aware of significance is the proposal for Medicare to negotiate drug pricing. That has a congressional budget office determination, 600 billion. 600 billion isn't $1 trillion, but it certainly gets you a good way there. And I know of no other program that would be able to get $600 billion together to pay for an infrastructure bill. So if the infrastructure bill goes through, what I'm saying is I believe the prescription drug pricing proposals have a much better chance of going through. Now, if you're following this, and I just do want to spend a little bit of time on this because it really does impact your industry so much. President Biden signed an executive order in July of this year that basically gave the FDA an order to create a path to import drugs from Canada. Now, just think about that. The plan would be that we would get all of our drugs from Canada. Well, look, that's not realistic. What it is a shot across the bow to the industry that the administration wants them to get serious about this. Congress, what we're talking about that will likely be debated this fall in November, is a bill that would allow Secretary Becerra to negotiate on behalf of 50 brand name drugs each year that don't have generic competitors starting in 2025. If the companies choose not to negotiate, there would be a price ceiling of 120% of the average cost of those drugs in Australia, Canada, France, Germany, and the UK. This would also cap Medicare beneficiaries at $2,000 for drugs, down from the current $6,550. Now, if Congress begins to talk about this in November, public opinion suggests that 88% of the public is in favor of the government moving forward. So you have to remember that in how politicians make decisions. If you've already been watching TV, you know what I'm talking about, because the number of commercials that are out there on behalf of, the commercials of the older woman talking about their need to afford drugs or their need to have choice of drugs, you're seeing this battle begin. If you happen to be in the Washington, D.C. media market, it is nuts. Every bus, every billboard, every subway is filled with both sides making their argument, trying to see if they can budge that 88%. So watch this closely. Let's go on to the next slide. The fourth major change and direction of health policy is telehealth. We saw a 50% increase in adoption by Medicare beneficiaries of telehealth during the pandemic. Now, 96% of self-insured employers plan to offer virtual services by 2023. That would have been in the single digits or 15% at most before the pandemic. We've seen in the public health emergency many waivers on both the regulatory and reimbursement side. And if you take a look at that picture, that's actually me with my white coat on in my office in Washington overlooking the White House, because I would take care of patients, I would take care of veterans across the country using telehealth. And I went to the president, I actually brought my telehealth equipment to the West Wing, and I showed the president as I took care of veterans and told him that what I needed to do using federal supremacy law was to get rid of the credentialing waivers, the regulatory waivers, to be able to help more people. And well before the pandemic, I was able to implement in VA almost all of the reforms, the exact playbook that CMS used when the pandemic happened. So I'm saying that because I know the power. If you get rid of the regulation, you do parity and reimbursement, what can happen with the power of virtual care and how much this can help people across the country, particularly in rural America. Next slide. The fifth issue to watch is the Buy American Act. This is actually not a new act. The Buy American Act first was passed in the Great Depression, again, in response to an economic issue. And so it's not a surprise that politicians are jumping on this now. President Trump issued an executive order on January 19th. Remember, he left at noon on January 20th. So the day before he left, he issued a final rule with the Federal Regulation Council that had three major changes. He increased the domestic content of everything in the Buy America Act from 50% to 55%. He increased the steel requirements for US origin to 95%, and he increased the price competition between international and domestic business by 20% for large businesses and 30% for small businesses. 5 days after he entered office, President Biden shot off his own executive order to show that he was going to be tougher on this. And that executive order resulted in a hearing about his executive order in the Buy American Act on August 26th, with final comment on that next week in September. So you need to watch this as well. That increases the domestic content to 65% in 2 years and 75% in 5 years. In addition, it creates a new office called the Made in America office that allows the Office of Management and Budget to negotiate with companies on this issue and to publish the percent of domestic equipment and internal components for every company. And it also removes the commercial IT exception. So if you've ever dealt with the Office of Management and Budget, they are not the most fun people. They are going to insert into this a new level of discipline. Let's go on to the next slide. The sixth health policy issue to take a look at and to pay attention to is the issue of health equity and health disparities. And there is almost no government policy or funding initiative right now that does not include an emphasis on eliminating these health disparities. This is a top issue coming out of the White House. And what this really does is it recognizes what we have known for many, many years, which is that the strongest predictor of health outcomes are where you live and your socioeconomic class. So in other words, your zip code means more in terms of whether you're going to do well with a health illness than almost anything else. And these types of health disparities or health inequities have not improved over the past 20 years. In fact, if you take a look at maternal health, and I've sort of pointed this out as a specific case, the United States has the worst maternal health outcomes of any developed nation. This is all due to health disparities. So you're seeing block grants, you're seeing new types of initiatives to try to address these issues. And again, in your business and in the pharmaceutical world, understanding an ability to address health inequities and health disparities is going to be important to understand where government policy is going to be going. Next slide, please. Cybersecurity, cannot underestimate the impact that this can have. It's underreported because people don't like to talk about it. I work with a major health system in this country that just underwent a cyber attack, and I can tell you it is no fun. Healthcare cyber attacks have rose in 2021 by 55%. When they happen in healthcare, they are expensive, the most expensive industry. Very difficult to prevent. This one health system that I'm talking about, when we traced it back and had the federal law authorities assistance in this, it was a foreign actor, and it entered through a very small piece of peripheral equipment in a rural hospital that attached all the way back to the major health system. And once a virus enters a piece, it can go into the entire health system. That's what happened. President Biden issued an executive order in May 12th, that required the National Institutes for Standards and Technology to define what's required in software development. NIST, as it's called, in August released their decision to have industry collaboration, public-private partnerships with some of America's leading technology companies to focus on expanding multi-factor authentication, initiating zero trust programs, improving incident response systems. Again, some of your companies, some of your industry is involved in this. If not, look for opportunities to get involved in it. It's a big issue. Next slide, please. The eighth one, and I put this in because I think this is going to have a big impact on our industry. When I came to VA, I made a decision to give independent practice authority to nurses and pharmacists. Turned out to be one of the most controversial decisions I made. I got 450,000 lobbying attempts to give me opinions, either through letters, emails, calls from members of Congress, or professional groups. I did not even know before this that there were doctor caucuses in Congress, there were nursing caucuses, there were pharmacy caucuses. I got called before all of them, having to say, why would I expand the scope of practice of pharmacists and nurses? I did it because I felt it was the right thing to do for our veterans. I entered the government during a wait time crisis where we couldn't take care of our veterans. By giving expand scope of practice, I addressed that wait time directly, and we got rid of those wait times. And I do believe we improved the quality of care. Pharmacists in the VA have their own clinics. They prescribe medications directly to patients. Nurses in the VA have independent practice. They're in areas of the country where we don't even have physicians caring for veterans and doing a great job. You will see this, I believe, much more nationally, understanding how practice is going to expand with the shortages that we are seeing now, shortages of doctors, shortages of nurses. You are going to see people with expanded practice authority. Next slide. We have 10 of these. I'm going to get through it quickly. I've also highlighted mental health and brain health. I think the pandemic has highlighted what many of us who have worked in healthcare for years have known, that this is a big condition that needs a lot more work. 41% of all Americans have suffered from a mental health condition during the pandemic. Drug overdoses up 24%. The Biden administration is putting a lot more money into mental health services and substance abuse, $2.5 billion. In August, even pediatric mental health received additional funding. So this is an area that I think industry will respond to. There will probably be more research, more development when it comes to mental health and brain health, because this is one of those long-lasting consequences of the pandemic, this realization that we have underfunded, understood, understudied brain health. Next slide, please. Last slide. And that leads me to digital therapeutics. I think this is an important area to watch. The FDA has established the Digital Center for Excellence. 40 digital health applications have already received FDA approval. Now, there's no doubt that this has slowed down because of COVID, with FDA's real priority being COVID diagnostics and therapeutics. This area has suffered, but this will come back, especially with that additional funding that I talked about in the beginning to FDA. FDA has established breakthrough pathways for digital health, much like they've done with medications. And as you know, as well as anybody, and particularly with Indegene's leadership here, real world evidence is becoming a significant growth industry. It's at $700 million today, projected to be $2.3 billion by 2026. Digital health, the digital world, is helping accelerate that, creating new data opportunities in real world evidence, and that will continue. Next slide, please. And big tech, of course, is part of that transformation. We've all seen just countless initiatives, new money flowing in by each of these companies into the healthcare world. That will continue. There will be market disruptions, and watching this, I think, as our country's healthcare system transforms is going to be very important. And finally, next slide. So I'm going to stop there. I know that I was watching the time, and I apologize for the technical difficulties that we had. If there is an opportunity to take any questions, any comments from anybody who may have some, I'd be delighted to do that, but I wanted to make sure I left a little time for that.
Thank you, Secretary Shulkin. That was a wonderful overview of the nature of regulatory policy, as well as other kinds of challenges which we will see and opportunities we'll see in front of us over the next couple of years. There are a bunch of questions which have already come in, so I will try to go through them. I don't know whether we'll have the time to go through all of them, but the first one which has come in is, obviously, as you highlighted, the budget has shot up by a significant 20% plus in the healthcare sector, which is a tremendous kind of change from the past year. So do you see the pandemic-driven policy changes remaining in place even in the future? Or is it a response to this emergency which will potentially lose steam and we'll be back to the same old, same old?
I think it's going to be somewhere in between. There is no going back to the pre-pandemic world, but some of what we've seen will retreat a little bit. You're already seeing providers going back to in-person care. You're seeing health insurance companies, when it comes to virtual care, pushing back and not in the economic reimbursement strategies, worried about fraud, waste, and abuse in telehealth. But CMS will not go back to pre-pandemic rules, because this has really been demonstrated as necessary and frankly, a national security issue. So I think you're going to see much of what happened on a regulatory front remain in place. You'll see a little bit of retreat, but what's more important are the unintended psychological consequences. Our workforce has changed forever. You're going to continue to see labor shortages for years. The mental health consequences are going to be with us for years. The push towards taking more premium risk is undeniably going to be a long-lasting one. The economic impact on how this is going to affect the pharmaceutical industry, both positive and negative. Remember, the pharmaceutical industry got a huge boost in public relations by coming to the rescue with the vaccine, and once again demonstrating the power of innovation and how important that is to this country and to the world. But on the other hand, the pricing issue is going to remain. So I think it's a great way to think about it. Unfortunately, it's not a black or white answer. It's going to be somewhere in the middle.
Yeah, wonderful. The next question is, you highlighted this fact as a significant thing to watch, which would be the Medicare, the solvency of the Medicare, and the potential ways to provide financial resources to Medicare. So that has a direct impact on the pharmaceutical pricing and the way the industry needs to contract, with probably outcome-based contracting, which you talked about. So
yes,
in your mind, what should be the way in which the industry should look at this emerging kind of a new scenario? Obviously, there have been some contracts where you have outcome-based contracting, but would that be a fillip to more R&D, more innovation, or is it like hunker down and try to minimize the effect of it, going down on the cost part of it? How do you see the industry potentially needing to respond to such a scenario?
Well, that's why I said, Rajesh, this is going to be an interesting couple of weeks, because if the infrastructure bill does go through, I believe that increases the likelihood we're going to see Medicare's negotiation on drug pricing, which will remove $600 billion from the industry. Now, when that happens, it's never equal across the board. There are going to be some winners, some losers. But I think that's a big enough number that finally the days of avoiding doing business differently, it's now going to come to the pharmaceutical industry. And from my point of view, this is an industry that has milked this pricing game far too long, and they need to understand that we do need to begin to start paying for healthcare differently. Now, I would think outcomes-based contracting will benefit those that actually have products that work, that prevent disease, that help people stay healthier. So if you have good products, I'm going to count on you as a winner. If you have high-priced products that don't have a lot of value, I'm going to count on you as a loser. But where the industry has fallen short is really understanding what's been happening on the provider side, what's happening as they're beginning to transition their business. And industry should be partnering with them. Industry should be working with the payers and providers to adapt to a new alternative payment model, instead of just trying to say, how can we do our pricing the way that we've always done it? So I am one who's never challenged by change. I think those that are innovative always do well with a changing, disruptive environment. I know those are probably going to be the clients of Indegene's, quite frankly, and they're going to do fine. Those that bury their head in the sand are the ones that I'm worried about.
Yeah, truly. This is something which we live on a daily basis, working with our clients. And you highlighted the importance of the digital health kind of tools, as well as the initiatives. And you personally are also very, very keen, as well as deeply involved in the digital health ecosystem. So what is your sense on how the digital health initiative can really help all of us and the industry to really take it to the next level?
Yeah, I am a big fan that part of the way that we're going to change access to healthcare and effectiveness of healthcare is involving the patient. That the way I was taught in medical school, to doctors make decisions and patients follow them, we know that doesn't work. And so therefore, we have to round this out. Healthcare needs to be delivered in teams of healthcare people, clinicians, and it needs to engage not only patients, but families and caregivers in certain conditions. And so the digital tools are an important way of engaging the patient and the family back into the healthcare process. And so by themselves, I don't have a lot of hope that digital tools by themselves are going to impact healthcare. But as part of a comprehensive approach between pharmaceuticals, payers, providers, and the patients, I think this is going to be a dramatically improved model of care. And so I think that much like we've come to rely upon Google, Dr. Google, when any of us get sick or want information, we're going to rely on data. We're going to rely on symptom tracking, on monitoring, on medication adherence. Whatever part of healthcare is going to be supplied, much like our computer supplies information through these digital therapeutics and digital tools. So I do think it's going to be an important part of healthcare in the future, and it's an opportunity to begin to start bringing some of the fragmentation of our healthcare system together.
Yeah, thank you so much for that. And then the final one more, I'll probably take one more question, which is, you touched upon the importance of telemedicine, as well as also highlighted the issue of mental health kind of issues coming in. So clearly from what you just mentioned about the digital health, you would see a role for technology and newer ways of managing healthcare as a team, using telemedicine, using these kind of tools to even impact areas like mental health, which typically has not been seen from that angle as much as probably some of these other areas.
Yeah. Well, if you invite me back next year and we get to do this in person, I will show you some of these tools that I think are beginning to change the way we think about things. One of them is a company whose board I just joined that takes the behavioral health care relationship between a therapist and a patient. It records that interview, records the session, uses natural language processing to go through the entire therapeutic encounter, and begins to start showing which parts of the encounter were effective and which weren't. So where did the patient respond well? Where did the patient not respond and is not listening? What was the therapist focusing on? What did they miss? So you begin to start using AI, data, tools in this mental health area in a way that we've never really thought about, the way that you can in cardiology or in endocrinology. So I think you're going to see the greatest advances in mental health and in brain health with this advent of new technology.
Thank you so much. And to now round this off, obviously we have a lot of folks from the industry, from different functional areas, who are grappling with their day-to-day. So from your vantage point, as we come to the close of this session, what would be the advice you would have, or your words of kind of perspective you would provide them in terms of how should they look at their future next 2-3 years? How should they be preparing themselves for responding to these challenges and transformation from a personal perspective, from a career perspective, how they look at the industry and how they can add value to the overall work they do?
Right. Well, first of all, the reason why I focus so much today on the federal government is because we're in a position where so much of healthcare now is paid for or regulated by the government, that the best place to look is by understanding what is being signaled with where the dollars are going to flow and what the policies are going to say, what the regulators are going to do. Secondly, if there's anything that we've learned, it's that you have to prepare for the unexpected. None of us in 2019 knew our 2020 and 21 were going to be spending it the way that we were. We're going to stop going to work. We're going to change everything that we do. So preparing for the unexpected is important. I've mentioned one of those, cybersecurity, but there are lots of other things that people need to be able to prepare for and practice for, actually, being prepared. Third, you have to understand what's happening around you. I expect that you're going to understand what's happening in your business because you live it, but broaden your perspective and understand what's happening of those that really impact your business. So if you're in the pharmaceutical industry, understanding what the payers are thinking and what they need to do to survive, what the providers are thinking, what patients are thinking, and begin to start understanding that our ecosystem is so tied together that you need to begin to think about ways to collaborate and anticipate where the rest of the ecosystem is going. And finally, I think when in doubt, put the patient right in the middle. The patient is the one that ultimately we're doing all this for. And those that lose track of it, and by that I mean who produce drugs and that are priced out of the range of most people, you got to put that patient back in the middle and say, is this really the right thing to do? Or do we want to try to reach more people, help more people, and do it in a different way? And that's not speaking against the need to make margin, make profit. Certainly understand that. But I think sometimes we lose track of why we're doing this. So I think that there's lots of things that we all need to be thinking about. And there's a lot going well in our industry that we can build upon.
Thank you so much, Secretary Shulkin, for the words of wisdom as well as perspective and experience which you've brought to this session. I know that time is running out, so we would have loved to continue more. I'm pretty sure next year we would be seeing, hopefully, a live session where, while we are great fans of digital technology, we would still love to have it face-to-face. So with that said, we come to the end of this session. Thank you, everyone, for participating in the various kind of sessions which we've been having. Thanks a lot for being there, and hope you enjoyed and you got to take away insights and ideas and thoughts from the best of the industry. Thank you very much. Thanks, everyone.